Hey there. If you're a dental professional, whether you're a hygienist, assistant, dentist, any of the specialists, office managers, or lab tech, you probably love your work. But I bet your neck, your shoulders, your wrists, your back, your hips, they might not feel the same way. Maybe you're starting to notice discomfort that used to go away, but now it lingers. Maybe it's turning into a full-blown pain, something that where you have to adjust your body constantly to deal with it, and it's affecting your focus, your productivity, and even your mood at work, and it may even bleed over at home as well. If this sounds like you, I want to tell you it doesn't have to be your normal. The truth is, dentistry is physically demanding. We know this. It's not rocket science. There's long hours in static positions. You have to do skillful, repetitive, fine motor movements. You're constantly leaning and twisting. These movements can lead to microtrauma over time, which builds into pain, and it affects not only your body, but your performance, your mindset, and even having to take some time off to deal with that. But it's not all bad. There's something that we can do about it. I'm here for you. So I work with professionals just like you who have said, my neck hurts and it's not even lunch. I keep popping Advil just to get through the week. Or I'm even having an extra bourbon at night to take the edge off. So I'm scared of this pain. It's going to shorten my career. I'm going to get disabled. Does that sound familiar? I hope not, but I just want to tell you, you're not broken. You're just unbalanced, and that's fixable. So, there is a solution, but it's not a one-size-fits-all answer. Generic stretches won't cut it. Posture tips and tricks and the top 5 exercises that you find on Instagram or YouTube will not rewire your pain. They might temporarily help, but will they get after the root cause of the problem? You need a recovery system that's designed for the demands of your specific job. So that's where I come in. I'm a physical therapist who specializes in helping dental professionals conquer and beat work-related pain with a simple, personalized, and proven approach. One that respects your time, understands your job requirements, and delivers real results that you can feel at the end of the day. Here's what working with me looks like. So we'll start with a phone or video discovery call. It's quick, it's free. You share what you're dealing with me. I listen, we get to know each other. I learn what's holding you back. And more importantly, where do you want to be? Obviously, you want to be pain-free, but what are some things and how is it affecting your life? Then we move on to a physical therapy evaluation session. So this is one-on-one or possibly virtual if you have time constraints, or I can meet you at your dental clinic. I assess your movement patterns, your pain triggers, work-specific habits. From there, I can build a custom recovery and mobility plan. It is specifically tailored to your schedule and your needs. So that's a lot packaged in such a small sentence. There's a lot going on that we help out with. So I just don't want to send you off with a plan and then disappear. Sometimes in the insurance-based system, you don't get what you deserve. You get maybe 10 minutes with the provider if you're lucky, and then they're gone. You might be lucky to get a few exercises to try, but this is something that I want to add to the failing healthcare medical system. I want to go above and beyond and pave a new way, show there's a better way to do things. So you'll get weekly accountability check-ins with me. You'll have access to my private mobile application, where you'll find your exercises, your habit trackings, your routines that we can try and assess and help you out with. You can message me directly through the app with any questions, wins, I like those, and any flare-ups. So I try and respond as best as I can in real time. And best of all, you'll receive a personalized strategy and basically a roadmap. So you'll know exactly where you're heading. You'll know how to get there, where you're going, step by step of the way. So I'm trying to make it as easy as possible and try and show you how you could take control of your situation and give you the knowledge on how to do it. I don't expect you to work with me for the rest of your life. I want to give you the tools to address this in the future after we're all done. So imagine now, 6-12 months in the future. You show up to work with less pain, or even none at all. You're staying focused on your patients instead of your neck pain, on your tight back muscles, on if your hand is going to shake during a certain procedure that you dread. You're able to do that now, no problem. You're not thinking of it. You're not cranky from tension at the end of the day. You're not taking it out on your coworkers or family. It's not intentional, but pain does that to us. Not just you, me, everybody else. It can change you. You're not missing work because of pain. You're showing up joyfully and with energy. Imagine that. You're more precise with your work. You're more relaxed. You're actually enjoying work again. You're meeting the productivity standards that you have to get through. So one of my clients, she's a dental hygienist. I didn't think 10 minutes a day or even 15 minutes a day would change anything. Now I barely notice my shoulder and neck pain. I'm way more present with my patients. Another one told me the check-ins kept me on track. I have trouble doing what I need to do, but there was simple buttons that you could click, and it was very organized and easy to follow. It wasn't a bunch of things that I had to do every day, 3 hours a day. Having someone who understands the dental pain made a huge difference. So this isn't just about your pain. This is about your longevity. This is about your confidence, joy at work again. This is about changing your stress levels in your life to help you live life to the fullest. That's what I care about the most, your goals and improving your quality of life, not just work. But that's very important. That's why you're here. So if any of this resonated with you, your first step is easy. Book your free discovery call. No pressure, no commitments, just a real conversation about what you're feeling, and then we can chat about how and if I can help you. You deserve to work in dentistry without sacrificing your body. And with a little support, structure, and strategy, you can absolutely achieve that goal. Let's get started. Call me, text me. Let's schedule something based on what works for you. Have a wonderful rest of your day. Thanks for sticking with me. I cannot wait to meet you.